Hi, I'm Garvin Lynch, and this is Lynch's Pharmacy Health Information video series. This video is on travel sickness. Nausea and vomiting are very common symptoms seen in a pharmacy and can be caused by a whole host of different elements, usually due to some sort of viral infection in the gut, like gastroenteritis, morning sickness due to pregnancy. A lot of different medicines cause nausea and vomiting. For the most part, it generally lasts just 24 hours. There are some situations where nausea and vomiting is associated with something more serious. If you have symptoms such as chest pain, blurred vision, severe pain or cramping, high fever, neck stiffness, confusion, anything alarming such as blood in the vomit would warrant urgent referral to your doctor. In the same way, there are other symptoms which accompany nausea and vomiting that would require a trip to the doctor as well. Maybe not with the same urgency. These include dehydration, lightheadedness, excessive thirst, reduction in the amount of urine being passed, dry mouth or tongue, haven't been able to eat for 12 hours or keep anything down for the last 12 hours, or in a child if they haven't been able to keep liquid down for at least 8 hours. If an adult has been getting sick for more than a day or two, they need to see a doctor. In a child under the age of 2, if they've been getting sick for more than a day, they need to see a doctor. And in an infant, maybe even 12 hours. In terms of advice for nausea and vomiting, simple things like taking it easy, as too much activity can make you feel sick. It's important to stay hydrated, getting at least 2 litres of water a day, especially if the patient experiences diarrhea as well. Avoid strong odours or strong tastes, as these can trigger reactions in the brain which will make you get sick very quickly. If you can eat food, eat bland foods, for example crackers, toast, cereal, rice, fruit, foods that won't trigger a response. And if you need to use over-the-counter medicines, if the nausea or vomiting is due to pregnancy, what many women find helps is to nibble on a few crackers before they even get out of bed. They find that this helps with sickness in the morning. So the medicines for nausea or vomiting would be Mortilium is probably the most well known. Domperidone is the chemical drug. It's a prokinetic drug, which means it speeds up the movement of the contents through the gut. It can only be used from 16 years of age and up. Up to 3 tablets a day can be taken, and it's very important to take about a half an hour before food. It just doesn't work very well at all if it's taken any other way. If it's travel sickness the patient is worried about, there are a couple of different products. Quells contains a drug called hyoscine, which is what's called an antimuscarinic. That means anybody with glaucoma shouldn't take Quells or any other antimuscarinic drug. It can be used from the age of 10 and up, usually 2 taken the night before travel and 1 every 6 hours after that, with a maximum of 3 tablets in a single day. Sea legs and Stugaron both contain antihistamines. Sea legs can be used from the age of 2 and up, usually taken 2 before travel or the night before, maximum of 2 in a day. For Stugaron, take 2 before travel and can be used from the age of 5 and up. If you are vomiting and have a bit of diarrhea, perhaps as well, dehydration is going to be a concern. So you may get some benefit from rehydration salts, especially if the patient is elderly or indeed very young. A sachet of Diarrhelite into a cup of water after every loose bowel movement or after every episode of being sick. So they are most of the products available. As I say, the main things to look out for is how long they've been sick. So in an adult, if it's more than a day or 2, they need to see a doctor. If it's a child, more than a day, in a child they definitely need to see a doctor, especially if the child is an infant. And just keep an eye out for any alarming symptoms like blood or chest pain or anything unusual like that. But for the most part, nausea and vomiting just last a day or two and will resolve it themselves. If you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into the pharmacy in Broaddale in Douglas, up Marybrail. Thank you for watching.